Okay, 12:02. Again, good morning, everybody, and thank you for joining us today. My name is Enrique Porras. I'm a Senior Director of Marketing here for Clara, and I'll be your moderator this morning with Susan. For those who are new to Clara, just a quick sync of who we are. Clara is a patient communication and engagement platform that allows the practices across specialties to communicate into one intuitive platform. Now, we help free up staff resources and transform high phone volume into convenient two-way messaging to help improve efficiency and automating workflows. Um, and since improving our patient experience is our mission here in Clara, we're excited to have Susan Childs here with us this morning to talk to us about how a patient truly perceives our interactions and really the practice across the entire journey. Susan, a little bit about you, just so that our audience knows. Susan has over 30 years of experience in healthcare. She's a fellow and serves as a medical practice advisor for a diverse array of physicians and medical systems. As a thought leader and communication specialist, Susan is a national speaker and an international author on emotional intelligence and leadership, patient perception, and physician administrator collaboration. Her most recent book is entitled The Emotionally Intelligent Physician Leader. So with that, Susan, welcome. Thank you for joining us this morning. And before sending it over to Susan, though, I wanted to learn how our audience is this morning in terms of how they know their audience, how they get to know their patients. So if you guys could go through your poll at the of your webinar platform and answer, how confident do you feel in your ability to accurately understand and meet your patient's communication preferences? This is just to give us an idea and to give you an idea of really thinking about it. So the poll just came up screen. I'll read it for those that might have some issues with the screen. It says, how confident do you feel in your ability to accurately understand and meet your patient's communication preferences? I need to level up my patient communication game. I could use some help in accurately nailing my patient's communication preferences. B, getting there. I try my best to understand how my patients want to communicate, but sometimes I feel like I need a few more tricks up my sleeve. Or C, totally rocking it. I make sure to try to listen to my patients and adapt my communication style accordingly. So about 8 more seconds on the poll, and thank you for that. All right, so now that we have the poll answers, Susan certainly will be sending it your way. But before that, we have 40% of our audience feel like they need to level up their level of communication. 60% of the audience feels like they're getting there and it's a work in progress. So thank you for the answers, everybody. And with that now, Susan, I'm sending over to North Carolina for a little bit of what you can share with us this morning. Over to you, Susan.
Thank you. And go to the next slide, please. And I mean, I was curious to see if anyone said we're totally rocking it, because there's no such thing as over communicating, especially now. And I'm sure that a lot of people have great communication things in place. I'm sure that's true. We can always improve it. There's always a way to do it, because there are so many venues and so many ways to do that. And with platforms like Clara and other things, you can really make it happen for yourself. So this is something I feel very strongly about. To me, it's all about the patient and the physician and that relationship and how we support that. So I think what my thing is to hold on to the most compassionate things we can do for patients while embracing new technologies. If we can blend both of them, we have the best of both worlds and patients are happy. And that's our job. Have you ever heard of there's a special on, I think it's on A&E or something, that's called The Forgotten Ellis Island. And I think about 30% of our Americans have come through Ellis Island to form citizenship. And there was a film about it, a documentary, and it talks about the hospital that was at Ellis Island and how they took care of patients. And there was one elder gentleman that said, this was my first introduction to the United States, was the hospital there. I think there were 3,000 people being born and 10,000 people being treated. And he said that the compassion was his first introduction to America. And it was a wonderful thing. And that's what we want. We want our practice to be that introduction to beautiful care. And we do that with emotional intelligence. Going to the next slide, please. This is very, very true. And we change our world every day. We are in charge. You're the practice leaders. You're the ones who set the standards for everything. And I remember the first time I had a management job, and a friend of mine said to me, "You will leave your footprint on that practice." And I didn't know what she meant, but it's true. We have our own style of everything, leadership, communication, and everything. And it's so important because, again, everyone follows what we do, and our own style is our own way, and that's okay. Think about your natural strengths and how you can communicate, and think how many interactions you have throughout the day with everyone that you talk to, patients, staff, and physicians. You can really change the world. And the next slide, we're talking about emotional intelligence. And I think this is very true. I don't think there's any gift better than to be able to see something through someone else's eyes, even for just a moment. When you're meeting with patients who are distressed about the finances or about their care or about a loved one, if we can see that and we can mesh with that and we can collaborate with them for the care, that's what it's all about. And I'm sure a lot of you have had training in emotional intelligence, or you're doing it without even being aware of it. It's just tapping into other people's thoughts and into your own, and having good control and being aware of your own actions and what you're doing, how you're coming off, the awareness of how you sound, and everything you're doing with every interaction. And again, everyone is unique, and that's okay. There's no right or wrong. You have to think about how your body, how you're standing, how it affects your behavior, and how your behavior may affect others as well. And that's what our day is about, is taking care of patients along the way. So as we move to the next slide and we look at a little bit more about emotional intelligence, there are different factors for that. There are personal and social awareness. Those are the two competencies. Personal is just what you think it is. It's the awareness of myself, how I know that I'm coming off to other people, the way I think, the way I stand, the way I communicate, the way I listen. That's communication as well. All different ways of communication, but we're aware of it, and we actually are able to sustain. And socially, that the social awareness is just what that sounds like, what we do for others and what we see in others. Now, an example of personal awareness is, I thought that tiger who's at the Denver Zoo, if anyone's been to the Denver Zoo, it's a great zoo. And that tiger's name is Ben, and I love him. And I was sure my emotional intelligence told me he wanted to play with me. My friend told me I was wrong. He wanted to eat me. And you can see how one of us was probably right. I wasn't going to take a chance, but I still want to play with him. In the social awareness, think again about your patients, their fear, and everything they're approaching as they walk into your door. And if you're aware of that and you're able to take care of that, and again, no one knows the practice better than you. You're in charge. You know every nuance. You know how the doctors practice. You know how the patients like to be seen, everything. And that is so important. One example of social awareness and emotional intelligence with your patients is if you do a lot of workers' comp. When I was running a family practice, we actually went out to the industries. We saw where they worked. We went to the stations where they worked. So when we took care of them, we would know exactly what they were going through. So the return to work was much better for them and their employers. It really, really worked well. And again, it's between that lines knowledge that you know. And the next slide actually shows us what we can have available to us. Because again, with patients, we want to be accessible. We want them to feel good about coming to our office. That's emotional intelligence. I work with so many offices where patients are walking towards the front desk, reaching for their wallets, smiling as they're coming to us and to reception. And it's a wonderful thing to have that bond. It really is. Your front desk, as you know, is so important. Now, here are some examples of another pleasant way to get healthcare. Ironically, these are both in airports. Think about that. The left one is in the Nashville airport. You can get a flu shot, you can get chocolate, you can get pillows. You feel good about just walking by there. It says wellness on the outside. So it's a wonderful, wonderful, welcoming thing. And I mean, again, it looks like a great experience. The one on the right is in a Florida airport. And that looks like you're going to have a party, right? You're going to see somebody and you can on virtual medicine, but it's really great for somebody who's traveling and they have a really bad cold and they want to be seen and they're stuck at the airport for 3 hours. Why not? I think accessibility, access is what everybody wants. Now, going to the next slide, we will see another newcomer, which everyone is aware of, which is Amazon. Now, again, the access is wonderful for people who can't get out of the house, for the convenience of somebody who's sick and doesn't want to leave the house, for someone who has a million kids and can't take them with them, there are so many situations where that's really good for the patient. Again, it's all about access. So what can they offer that you can't? They say you can be seen in the same day. So we have to be sure of that, right? We also say you'll get answers within 24 hours. We have to ensure that. My statement to you would be that something you can offer that Amazon does not offer is a continuity of care. There is no continuity of care when you're seeing somebody online all the time, unless it's very special situations and you have a personal relationship or a professional physician-doctor relationship and you're seeing somebody weekly, you create a bond there. But unless that happens, if you're on the internet and you're seeing somebody, it may be something different, somebody different every time. That's true in our practices as well. You can see the things that we have to think of and improve to improve the patient situations and their experience. Seeing the same provider time after time is one of those things. And if they can provide that, then so can we. And going to the next slide, one thing that's very, very important for patients is please, please tell me what to expect every step of the way. The biggest thing that I get told is patients want someone to listen to them. So please tell them what to expect and then listen to what they need, because that's what they're looking for. Communication is key, as we know. Think about your website. Your website has 83% of your patients visiting it before they even enter your door. So you have to make sure that that communication is valid and it's still on time. For example, callbacks, make sure everything matches. If you have a pediatrics practice, you can show their play area so the kids feel welcome. They'll recognize it when they walk in the door. They can anticipate something. And patients anticipate everything. 94% of your patients anticipate their visit with you, and it's based on their last experience. So if it was a good one, then that's what they're looking for. If they were given a hard time, that might be what they're anticipating as well. So remember that as somebody walks in your door, there are a lot of anticipations going on. And remember too, being prepared for things like natural disasters. If you have that on your website, if you communicate that, that's a really beautiful thing. Tell them what to expect. Another great example is aftercare instructions. This will reduce your phone calls and improve your communication. People will reference it and people aren't freaked out calling you, not knowing what to do. Now, in the next slide, what I'd like to ask you to do is think about 3 things that you would like to know for your patients and 3 things that you would like your patients to know about you. So for the 3 things you want to know from your patients are, what do they expect? What do they need? What do they want? What do they desire? Now, if you do continual surveys, you will see a lot of that. You will see patterns appear as new employees come and patients come and go. You'll see that. But do patients know what you need? And they are responsible too. Think of all the things that are coming down the pike with patient engagement, PCMH, self-care, a lot of things involved. We know what we're supposed to do. What are patients supposed to do? And how can we meet in the middle? That's collaboration. And that's where we can get to the care that they need. And going to the next slide, what we're looking at is always planting seeds. We're always planting those seeds of trust and confidence. And we're looking at partnership of care, that relationship between the physician and the patient. The physician only gets 10% of the visit with them. Everything else is the prep for the visit, the scheduling and getting ready for it, the lab work, any paperwork that has to be done, any insurance, any claims, anything that has to be done. So by the time they get to the doctor, it's the icing on the cake, and we want that to count. So we want that independent decision-making and communication to really, really work with billing issues and everything, working together. And that's a true collaboration as well. And again, no one knows the patients better than you. Now, the next slide shows a sign that was actually in an office that I worked with, and it was next to the scale. And I think this is beautiful. And I don't know about anyone else, but I hate getting on that scale. I don't like it. It's not often pleasant. Sometimes it is, but sometimes it's not. So to have this kind of message that this relationship with your weight doesn't measure anything, character, beauty, talent, purpose, possibility, strength, or love. Who would not want to tell their provider anything, everything, because you're wide open to acceptance? And one thing about your scale, some people don't mind having it in the middle of the hallway. Very few people like that. Patients won't say a thing because they're doing what you tell them to. But please don't have it where other people can see. Teenagers especially are very sensitive to this. Obese people are very sensitive to this, and very few people are very comfortable getting weighed in the middle of a hallway. So even a shield, something, some kind of barrier, so somebody walking by doesn't really see what's going on, that would be great. And going to the next slide. Another way to get your patients actively involved is to put things like this up on your wall. This is actually from my doctor's office. I was there for a physical, but think about it. I'm there for a physical. I'm in healthcare. I'm looking at this note. And this is a great example of communication because the insurances have changed physicals in the last several years. You used to go get a physical. Every part of your body was checked. You talked about all your meds. It was very comprehensive. Since the insurances have now denied a lot of claims and recalculated and recalibrated your wellness visit, they are defining exactly what's going to be covered. So anything outside of that is going to be considered a separate visit. Your physicians, of course, will code appropriately for this, but your patients may not know this. And if someone's on a high deductible, what happens is they get a bill for another visit where they were told their wellness visit was covered. This is not good communication. So one thing you can do is have this up there for people who are having physicals to note that, please, these are the things we're going to cover. Anything outside of that may be considered a separate visit. Is that okay with you? And this, when you think about it, puts up a barrier to communication because people are automatically hesitant. I don't want to pay more. Maybe I won't talk about what's bothering me because I only want to talk about what's covered. And that's where our relationship really makes a difference. If you get another visit and you have to owe money, we'll talk about it. There's financial health as well. But again, access to everything really makes a difference. When my brother was really sick, what he would say is, please just make it easy to see a physician. And that's what we want to be able to do. And going to the next slide, when I asked my mother what she wanted from the doctor, she said, there has to be a conversation. There needs to be a conversation. And that, of course, is communication. Now, doctors used to interrupt every 18 seconds, no, every 12 seconds. Now they interrupt every 18. So they've gotten a little better and they're listening a little more. But remember that collaboration with that independent decision-making and talking about your medicines. Well, doctor, if you tell me I'm going to take this medicine 4 times a day and it makes me feel bad, I'm just not going to take this medicine and I may not tell you until my next checkup. So instead of that, speak with your doctor about it and say, I don't know if I can take this 4 times a day. What if I took it 2 times a day? What if I took it for a shorter period of time? That's the working together because you want things in the patient's chart that actually are happening and working. And that adds to the continuity of care and also improved outcomes and the communication. Patients are incredibly loyal to their doctor. They will go through the rudest front desk receptionist to get to their doctor. We know that, right? Because that's who they want to see. And again, they're the icing on the cake. But think about it again. Make sure that everything jives. When you have that information out there for callbacks, when the physician will be getting in touch with you, everything like that. And with patients, please make sure that they all jive. And remember that providers set that standard for all of us. So whatever you discuss with the provider, whether it be financial policies, patient policies, make sure they're on board so you're all relaying that same message, because that way the patient hears one unified thing from everybody. And those are things you can settle at meetings, you can do them at retreats, setting new policies, and just making sure that they all stick and everybody's respectful. And providers do set that example for staff, so that's very important. Now, the next slide, I really have a good question for you. When I am a ghost patient or I'm just working in an office, how do you think you appear to patients really? Because one thing I noticed in one office was a nurse and a physician that would kid around just a little bit too much. And to them, it was okay because they were kidding around with each other. But to patients, it seemed very inappropriate. The nurse would second guess the doctor with their judging of prescriptions. Well, are you sure that will work? You tried that once before and it didn't work. Slapping each other on the shoulder, things like that. Things like that, being friendly and doing that with your staff members is great behind closed doors, but in front of patients, we should be respectful and professional with every level along the way. I'll call a physician by their first name behind closed doors, but in the hallway, it's always doctor. And that's the way it should be. And it's very good to be friendly with patients, but there needs to be boundaries and respect established along the way. And you can do that with a lot of respect and setting up those things. And remember too, when patients are saying something to us, how we appear. And remember that patients, when they say things to us, they're very nervous and they may not really realize what they're saying because they're very nervous about the care. Sometimes you may want to have a script to get started with people when they're first learning and then they make it their own. There's nothing wrong with that. You get into the habit of doing something and it becomes second nature. And that can be with any protocol with nurses and front desk and referrals, schedulers, anybody. If you build that customer service and patient satisfaction measures in there, then it becomes automatic after a while. The next slide, please. So I think the best way for making patients happy is making staff happy. Patients used to come to my practice and say, do you have any openings? You guys look like you're having such a great time. And we did. We worked hard and we played hard. And that really, really made a difference. So I think the very best way to show them, and this gets rid of a lot of barriers and lets them show you their pride, sit in their seat with them at their station. Ask them, what do you like about your job? What don't you like? And how would you change it? They will be very specific and they will be very proud. And again, it's their realm. It's like having a teenager behind the wheel of a car. You know, they're in power, they're in control, you're in their world, and it's great. And it's great freedom. And it's great to affirm them at that point too. You don't just wait for anniversaries or evaluations to affirm what their value is. Doing that in front of people and making everybody feel good about what they do, it makes a really, really big difference. And think about it. I think that every staff member and every group are like quilts. We all have different textures, different sizes, different colors, different everything. But we all come together and we make this beautiful quilt of care. And it's really, really good. That's what people see. We want people to see people being streamlined. Next slide, please. You only get one chance to make an impression, and it's really true. Your first impressions are made in 12 seconds. That little bee is up there because I went to a practice and there was a bee's nest at the front door. Nobody knew it because everyone went through the back door until patients said something to them. You can have a beautiful front door, but a bee's nest kind of takes away from that, right? The second picture is a practice I worked with, and this is a very natural thing. With every single policy, you get layers and layers of notices. So after the session, go out front, have your front desk go outside, excuse me, and look in the front desk and see what they see. Because when you look at it from a patient's point of view, it's very different. I do this with every practice I work with. And I remember one practice I worked with in Texas, someone said, oh my God, I have to close that closet door. Look at all that stuff showing and all the stickies. You don't realize it because it becomes like your living room. And remember that everyone, again, makes that first impression and it's 12 seconds and it is the front desk. They are your first impression and they are so important. And people cannot work well with it without the other. You also get a chance to refer to each other. And this is a great way to, again, collaborate with care. So if, for example, if a physician takes you to the lab, patients to the lab and says, this is Susan, our new lab tech, she'll take great care of you. I'm the new lab tech. I feel great because you just said I was great. The patient feels comforted and everyone's introduced. It's a great, great way to introduce and feel that collaboration and feel like everybody is working as a team. That's when you get to do that. Another thing to think about is, oh, we can go back one, please. Oh, thank you so much. Go into your bathrooms, go into the exam rooms, go into everywhere. Listen, again, I'm a ghost patient. And if you just sit there and listen for an hour or even 10 minutes and go in the lobby and just sit there and listen, you will be amazed what you hear. Think about the walls. Think about what's behind the exam bed, because that's where patients look while they're waiting. They look at every sign, make sure that everything is nice and clean and very welcoming. And if the patient has to wait a while, let the nurse apprise the patient of that and say, you are third patient. We're putting you in, you're one up. There's only one patient before you. Let them know, because if they anticipate, that makes it even worse. Now we can go to the next slide. Thank you so much. So patients have a lot of pride and fear. And if we can protect that and reduce the fear, we've done a lot. And this is really about financial health, because financial health can be a lot about communication as well. Most of you are looking at your schedules a couple of weeks ahead. That is a really good thing to do because we don't want to, again, hurt their pride as somebody walks into the front desk and somebody says, you have a bad debt. You can't be seen. You owe us $5 million. Why didn't you tell me that 2 weeks ago when I made the appointment? Maybe we could have arranged something, or else I wouldn't have come in, or I might not have made that appointment. But don't ever put the patient in a place of shame. So call them ahead of time. You might even get payment ahead of time and make those notes. So when the front desk person checks them in, they know exactly what to do. Working out payments, transparency with the appointment and financial obligations. By the time the patient walks in the door for their appointment, it's the third time they should be reminded of that. Because the first time is when they place the appointment. I see you have a copay of whatever, and please be prepared to reimburse, please be prepared to pay any kind of copays or co-insurances that may be applicable to your visit. We know you have a $10 copay so far. Thank you very much. When you get that reminder, that can have that on there as well. And the third time is when the patient walks in the door and the front desk says, we'd like to have your copay. It is so and such, so much money. And you ask for it very nicely. That's the third time. That's why also patients are very aware of what they owe beforehand. It's a really nice thing to know that. And if you define that ahead of time, you can literally separate the money from the care. That's a beautiful thing. And then they can concentrate on getting better. Now, the next slide actually shows you those 6 basic emotions. And look at these. How many of these are we actually covering? Happiness is not often when you're coming to the doctor. That's just the way it is. We often come when we're not feeling well. Now, our wellness visit, or if we're getting better, that's a beautiful thing. And that could be surprise, you're getting better. That's great. But again, what do we anticipate? We anticipate we have to pay money. We might hear something bad. We're afraid something may happen. But happiness is in there somewhere sometimes. But if you can approach at least 2 of these emotions, you've done your job. Because again, people will not say something to you, but they will sit there in fear. Now, the next slide shows actually, this happened to me when I was a ghost patient somewhere. And what I do is I go around, I was at the diner the night before or something. It was this little town. And I said, my arm is really hurting and I'm not really sure where to go. Is there a doctor in town? And they referred me to the practice that I was going to the next day. But they said to me, I'm not sure I'm getting the best care. And I said, why not? And they said there was never a closure to care. They never said, well, you're all done now. Your treatment is done. You're getting better. And I wasn't really sure if I was done. So these are things that we really want to think about that we don't think about, but the patient is looking for. So good closure, you're all set, things like that. Come back as you need. You don't need to come back till November for your physical, whatever you want to say. But remember, think about that. And you see the every 18 seconds here. One patient I heard was told they were a waste of space in the hospital. The doctors told her to go home and get over her diagnosis. She has since signed on with a doctor that I helped set up, who was self-pay, who listened to her, and he helps her with the pain because these other physicians were not listening. Another friend of mine told her doctor came into the hospital room of a teenage son who had broken his arm. And he tapped his watch as he's walking in the door and says, my son plays football at 4 and he doesn't like when I'm late. My friend said, you're fired. I don't think she liked him before that. And apparently she was not the first one because the doctor phoned her that night and said, will you take me back? And she said, no, that was absolutely horrible. You were obviously not even interested in seeing my son. And since then, she got another physician and she was very happy for the completion of care. Another friend of mine told me she had to literally block the door for the physician to keep them from leaving because she couldn't ask questions unless she did. And another one is a prescription debate, similar to the one we were talking about before. If you don't think you're going to take the medicines as a patient, I'm hoping that physicians and other staff members are emotionally intelligent enough to say, you know what, are you comfortable taking this? Will you be taking this? If not, let's talk about something else because it really, really makes a difference, again, with their continuity and outcomes. Now, the next slide is something that I have heard over and over again. You see that little car to the right, and we were constantly compared to Toyota. And I'm so tired of being compared to Toyota because we are not. We are not a process. We are handling a bundle of emotions. Now, I did something online and I took a survey afterwards. And you see on the far left, what should Sharon be recognized for? Sharon was the person helping me, obviously. But you see now that empathy and communicating clearly are on the list. Not just did they help you, did they provide a solution? Were they pleasant? So they're really looking for that empathy and compassion. And that's something that we all have. We just tap into it. And when you look in the picture of the middle, in the middle of the screen, you will see a registration kiosk. Now, I have to say this looks like a toilet. Now, you see all these arrows pointing to the button. They're not even paying attention. If they just press and they painted the button red, you would see that. But you can see they're not really into communicating at all because you have to grab a number. So if you grab a number, my question is, what happens after that? And we will see actually in a few slides. But just remember too, when we're going to see the doctor, the higher the emotions, the more confused we are, the more fearful we are. We do not want to be treated like a machine. So if you want to know for sure, ask your front desk if we're like Toyota, and then stand back because they get the guff of everything and have to be most personable. Now, a great example of personable is the next slide, where I will tell you about my grandfather, William Fink, who was a pharmacist who became a family practitioner who also delivered babies. He was in Brooklyn, New York. And my father remembers patients that could not pay their bill, but they had pride. So what they did was they traded instead. And he remembers waking up and finding apples outside of the door, clean clothing, meats, repaired clothing, things like that, because they couldn't pay for their services. And again, my grandfather said, well, why don't we barter instead? Now, I know that we can't barter for services, but we can keep that mentality in mind that everybody comes from their own place and we can all do something for somebody, maybe in a different way. But keeping that in our day-to-day lives and our processes and our procedures in that mindset is really, really important. And that's emotional intelligence. Now, the next slide is an example of what we want to conserve. Now, you may recognize that little registration ticket from the other slide. And what this is from is when you go into this hospital and you have lab work, you go to the end of the hallway, you pass by 5 people who are registering people, all empty offices at that moment when I was coming through at 7 a.m. But I had to go to the other end of the hallway to get this number for me to go back and be called by a machine. Now, my question is, are they forced to do it that way? Why couldn't someone just say to me, come on in, no one else is here? We are so into our protocols and compliance that we have to think creatively for the patient. We have to think outside the box and have to complete their sentence. That's our job, to take care of our patients. So these things, the traditions to conserve, the empathy, the listening, the eye to eye, the touching, things like that we've gotten away from. And even with technology, we want to be as personal as possible. And communication is just key with that. We do not want to be trapped by our protocols. We want to embrace these new technologies and make our personalization even better. Now, going to the next slide is really just thinking about what keeps us dedicated, what keeps us going, because our patients notice that too. And it's been hard to do that. Excuse me, with COVID and everything. We're now recuperating, we're coming back, right? And it's really good. The resilience has been wonderful. And if I hear that word resilience one more time, I'm going to scream. But it's really true because that's what we're doing. We're coming back. And the resilience is working. It really is. So we ask about what keeps us here. And I remember hearing somebody speak one time saying that people in healthcare have a special calling. And I remember thinking, well, people in other industries have that too. But I have to say, in healthcare, we're healing people. It's a beautiful thing. My sister says that she remembers a story about someone who said it's impossible to forget someone who's taken a thorn out of your paw. And we have that. We have that with our patients. We have that dedication. We break down barriers. We're able to speak with them. We're able to make them better. And that's a wonderful thing when you see that. Another thing that keeps us dedicated is just being civilized with each other, just being respectful of each other. And going to the next slide, the beauty of working in healthcare is that we get to do this every single day. And what we can do is keep that heart in every decision, because we need to do that. We have to remember compassion. I call it balancing the checkbook with compassion, because that's what managers have to do. We have to order that, we have to have that compassion and keep that front and center, but we also have to balance the business and keep things going. So thinking about things that you can do now, remembering again, keeping that heart in every decision, using your emotional intelligence on a personal level and in your relationship management, being aware of those cues of what might set you off, such as an angry patient. Are they validly angry? Is there a valid reason? Can we control them? Can we make them happy? Can we take care of them? That's the key. And listening on every level, and then listening to everybody from janitorial up to CEO and back down again, and to patients, listening to everybody for that collaboration of care. Also make sure that people are taking time for themselves, so we all feel refreshed and good about being where we're working. We definitely want to do that. And people's lives change as people's lives change. And the best thing about emotional intelligence is, as things change, we can foresee that and anticipate what our patients may need, and then take care of it and be very proactive about it. That's what keeps our patients with us, right? And nothing is static. We never do it alone. We all do it together. There will always be barriers, but we can always keep in touch. And it's finding that time to listen that makes all the difference. And then the last slide. When I was writing my book, my aunt, who was married to my uncle, who was an ophthalmologist in Brooklyn for about 50 million years, wrote this about the relationship between the doctor and the patient. And that's what we're all here for, right? They give comfort to desperate people, feel safer with a doctor who shows kindness and empathy. And when a patient trusts their doctor, it becomes a higher level of treatment and takes on another level of dimension. I love that. And doctors can help with compassion and knowledge. And I think that's a beautiful thing. And if we can all do that, I think that's what we're here for. And I think my last slide is my information slide. And if you need anything at all, please feel free to call me or get in touch with me, and Clara as well. And I hope you've enjoyed this, and I look forward to some questions.
Thank you so much, Susan. Definitely, I know we can chat about this for more than an hour. There's a lot more that we can really dig into. So if anybody has any questions, please feel free to use the Q&A function within the Zoom platform. I do see we have some questions already coming in. So with that, I see 4 questions. So the first one is, how can you make communication feel human when you are communicating with patients using digital communication platforms?
Make the message as human as possible. People like to hear thank you in their name more than anything else. So if you make it as human as possible, there's nothing more exasperating than trying to talk to a chatbot or somebody with communications when all you want to do is get to customer service. So make the communication succinct and personable and from the heart, like you're really talking to someone, not just giving information. Make it very personal.
Okay. You were talking about emotions. You had your six little faces. The question is, there are some patients that are really hard to handle. What do you do when no matter what you do, they are not happy?
It depends upon their situation. And as you know, I have, and many people have, lots of programs on how to handle difficult patients. But there are some people that are just never happy. They're just never happy. And they're like that at the bank. They're like that with their family. They're like everybody. And that's what, and like, they're like that with everybody. So if you need to, depending upon how difficult they are, if you just sense that they're not happy and you feel like you have a great relationship with them, I would say, call them into your office and say, you know what? I sense something's going on. What can I help you with? If they're screaming and yelling and you're not able to communicate with them, that's a whole different thing. And that's a whole different situation. But usually if they're not happy, you say to them, how can we make you happy? And sometimes you cannot make somebody happy. And sometimes you can have the provider speak with them and say, Susan, I don't think you're really happy with the care here. What are your complaints and what can we do to make it better? And if we can't, maybe we just need to refer you to another place. Often people realize that they're just complaining and then they stop them because they don't want to go to another doctor, because some of these people have already been to 30 doctors and now they're at yours because of the same situation. So if you try to understand them and go to where they are, and if they're not happy, you have to transfer them over, then you have to do that. But if not, hopefully you can. And a good conversation, if you already have a good relationship with them, that should go pretty well. And just sometimes they need you to ask. They're afraid to say something.
Okay, thank you. Another question, it says, how can I get my doctors to listen to me about patient complaint issues? They usually brush them off.
It's true, because by the time, and I know that every manager is laughing now, because by the time the patient gets to the doctor, they're so pleasant and they're happy. And what do you mean they were complaining? Because the front desk and the rest of the staff gets all the guff, because the front desk has to ask for money and the front desk has to make them wait. And it's just like the waitress or waiter with the food, where, they're kind of responsible for it. So I would say that, I would actually make it official, and I would show them how much it's costing. And if you have one patient that constantly disrupts patient care, or if you have one patient that is costing you money, you can actually show that to them and document. I would also make it official by creating an incident form so that when it's brought up to them, like when I was a manager, I would have a weekly meeting with physicians. Now, when a complaint comes up, I would take it directly to the physician. And an incident report usually looks like the patient's name, the date, what happened, what their complaint is. Then you have your response. And when you go to the person they're complaining about, you document that. And then you go back to the patient and you say, this is what happened. I think it's really good to follow that form, because that way the doctor can see, wow, this really is serious. This is documented and this is not happy. And the more they get, you can bring it up to a board, but it's really important. I would bring it up to them in black and white on paper, as well as just telling them, because in our mind, we can rationalize things. That's what separates us from the squirrels, right? But when you show something in black and white and you look at something like somebody who's written you a letter and you're reading it, it becomes real. That's why we like people to sign things, because then we take it more seriously. And it's the same thing. So that's what I would suggest.
Perfect. These next two questions might get a little techie, Susan, but the first one is, you brought up Amazon. How can we compete with such easy offers like Amazon?
It's a whole new realm, and somebody might actually use Amazon for the televisits, but they might see you for their physicals. So another thing, well, first, as I said before during the presentation, is every doctor I work with, sometimes they're intimidated by insurance companies, by the hospital moving in next door, whatever, or by their competitors. And I say to them, if you have a panel, if you have patients, you have people who trust you, and you go with that, do not be intimidated. Take that. They chose you for a reason, and use that, right? But another thing Amazon cannot offer is that sitting in the room. And I don't care if your x-rays are read anywhere in the world. When you're in a room with a physician, that is an intimate setting, and there is nothing more personal. For example, I've given birth in front of my husband. He will never know how much I weigh. He will never know how much I weigh, but I will talk about that with my doctor. Will I do with that some that on a screen? I might not get the same person next time, because who knows what's available? You don't know where these people are. You want to have a personal relationship with your physician, and that does not offer it. It really doesn't. It also does not measure your outcomes, your personal outcomes. And what happens if all of a sudden you call up and that doctor's just gone? Now, that can happen with any brick and mortar practice as well. But a lot of times, if you're seeing a local doctor, you can follow them to the practice they're going to. There are many more options in person, but the online offers access. But what are you offering that Amazon doesn't? Yourself. That's what you're offering, is you. And hopefully that's value, especially when you show your value in the community, local fairs, local farmers markets, local health fairs. When you have a presence in the community, that makes a difference.
Thank you. This question is a little bit about how the evolution of the communication has happened, but it says, what role can technology play in improving patient communication and patient experience before, after, and during visits?
I think Clara can answer that. No, really, that's a perfect question, but that is a really good question, in that they see the importance of that communication before, during, and after. Again, it's that closure of care, like I talked about. That's really important. We hope so beforehand. is your website, and who's checking out your website. You want that best portrayal. So communicating on your website, communicating to patients that have HSAs, that you are actually able to make a payment plan. Don't worry about it. Check out your plan or give us a call for your specific plan or benefits. And that way you're open to them. They call you, you set up a payment plan ahead of time. It's a beautiful thing. Also getting the appointment you want, being able to request that. That's great communication. Anything that makes it more personal for the patient and for my options. It's like picking out a flight from an airline, right? You want the one that you want the best. During walking in their door, the front desk, the front door, the curb appeal makes a huge difference. If you have an empty parking lot that looks really bad and it's full of holes, that's a bad impression. That's communication. And superior communication is relaying something completely clearly and then being completely understood. So if you have a sign on your front door, open 10 in the morning till 5, but you're open at 11, that's not good communication. So you have to make sure everything jives as well, all the way to the visit. When you're registering for the visit and somebody walks in the door, I think, they're walking in the door and you're greeting them and smiling. That's affirmation that the patient chose the right place. You're communicating that. You're communicating that they made the right choice. And I'm going to be nice to you when I see you as a patient and collect your money. And then as the nurse smiles, the eye-to-eye contact, that's beautiful communication. Taking your vitals and asking what the problem is, asking how you're doing from the last visit. You may also know them personally, because if you're in a small town, hey, I saw you at PTA last week. What's that chocolate chip cookie recipe? All of these things enter into your relationship and the loyalty that patients have towards your practice. Seeing the doctor, having that collaboration is a beautiful thing. A lot of doctors say when I'm using technology, it's very hard to do when I'm having a conversation with the patient. They don't feel it's as personal. One doctor I work with, have them look up and down and say, this is what I'm doing in the system. And I have them show that as well. So the patient sees that. It works really well. And then the closure, your claim is paid. That's technology. Hopefully that's worked well. And then you could even text them a message. Thank you so much for your visit. And then have a survey if you like.
It's exactly what you're saying. This is what we're seeing also from the Clara standpoint. If I could add a couple minutes here, which is exactly
please.
that. It's how can the patients talk to us in a practice in the way they're getting used to talking socially with your friends, with their families, especially after these last couple of years that it's been really tough for everybody, particularly for healthcare. But the ability to schedule via text, the ability to pay via text, the ability to answer any survey questions via text.
Everything, yes.
And not just from a patient perspective, but also the practice itself, right? Being able to talk across practices if you have X amount of practices in the state. So, thank you very much, Susan. Like I said, this is something we can continue talking. We have a couple more minutes. I don't know if there's any other questions out there that you want Susan or myself to answer. While you think of that, I do have one last poll that I'd like to just share with you, particularly about Clara. Before that, though, I did want to share that this presentation, of course, is for informational purposes, and that if you need any legal advice or any healthcare advice, please go to the right authorities for that. But with that, if we move over to the poll, please, if you'd like to learn a little bit more about Clara, whether it's learn about our information, see a demo, get a consultation, or just start learning about the evolution of patient collaboration and communication, feel free to reach out here. Of course, we will not send information unless you want to. So with that, we'll leave this up for about 5 more seconds. Susan, again, thank you very much. It's always a pleasure to speak with you. I know we were just a couple weeks ago in Orlando together in another conference, but it's always a pleasure and an honor to be with you, to hear you talk and really share that experience with everybody. A couple more minutes for anybody who has any last minute questions. But with that, I think we can close on the poll. And again, if anybody has questions that come up after the conversation, feel free to either contact Susan, there's her email, or ourselves at hello@clara.com. Would certainly love to answer any more questions. Again, thank you, everybody. Have a great Wednesday,